I'm a consultant in old age psychiatry, and in broad terms that involves the assessment and management of mentally ill elderly. And there are two main groups of patients. There are those who are suffering from the consequences of dementia and those who are suffering from so-called functional mental illness like depression and psychosis. My typical day involves working entirely in the hospital because the service is now split between community teams and inpatient teams. So my time is spent supervising junior medical staff, doing their endless stream of workplace-based assessments, meetings with patients and their families to plan discharge, or in the case of people who lack capacity to make decisions, we have to hold best interest meetings, which are always very stimulating. And then the other aspect of my work is, like many old age psychiatrists, I'm also in charge of the ECT department, and we run 2 clinics a week. What's great about my job is dealing with older people. I love older people, and they're walking textbooks of modern history. But the other aspect of my work is that it really lies in a kind of overlap of Venn diagrams between psychiatry, general practice and geriatrics. And I still love general medicine. I don't like the fact that computers now dominate the workplace. I cannot type. I don't like the fact that the rather inelegant term bed blocking applies very markedly to old age services. Social services are very strapped for cash, and that means that it's hard to set up packages of care, and then the ward silts up and we have an ever lengthening list of seriously mentally ill people needing to come in. I would recommend it as a career because I think the elderly are still the most interesting and the most polite people. I know that seems a very silly thing to say, but I enjoy dealing with people who are a joy to interact with. I love the fact that I'm still using general medicine. I love the fact that I can still do practical things. From time to time I have to stitch someone who's had a fall. The population is aging, and there's always going to be a demand for people who have an interest in general medicine and elderly mental health. The most interesting thing I did recently was I had to do a mental health act assessment on a lady with schizophrenia. We got a warrant of entry from a judge, and the police were about to knock the door down with this huge red door knocker, and I realised her window was open, so I thought I'd climb in to prevent her door being destroyed, and I fell in and found that she had a puppy that she'd just bought, and this puppy thought that me lying on the floor was great fun and started barking very loudly. So I picked the dog up and then opened the front door, and the policeman said, "Well, the dog has got its own back on you," and I realised it had urinated all over my shirt. But luckily my hospital was next to Tesco's, so I got a replacement for £3.